already know, I'm a family practitioner and an obesity medicine specialist. I'm also a health policy fellow. Everybody comes to me mainly because they want to know how to do the ketogenic diet and how to lose weight. And so I figured I'd talk about the 10 fundamental truths of obesity and what those mean. Many of us are here because is weight really a problem? Is obesity a problem? And that actually it truly is. The reason it is that as of the year 2000, if I can find my pointer, 19.8% of us were obese. And today, or actually this year, it's 39.5%. They expect by 2030 that 1 in 2 people in the United States will be obese. That's half the population. The average American gains 1 to 3% of his or her body weight every single year. And that's a pandemic problem. That's huge. It's what I see every day. It's what affected me, it affects my family, it affects literally 3/4 of my patient population, and so it's a challenge. You've seen these slides before, and the CDC likes to change up the slide set because what happened was you saw this with Nurse Cindy. In 1985, they started measuring and they got to the color black, and there's no color darker than black, so they had to change the colors because now West Virginia has 40% obesity this year, and it's huge. We keep gaining, and people keep restricting their calories, but we keep gaining, and so there's a little disconnect there. 9 months of solitary confinement, and this is what I have to put up with. What are we doing to our children? What's going to happen to our children as they enter? What we know is that what you as a mother eat while your baby's in the uterus genetically codes that child on how to use protein and fat and sugar. And so those are big challenges that we need to look at. So as a health policy fellow, one of the things I look at is what the policy that we make around our food, what does that do to us physically? What are the unintended consequences that arise? And because we introduced this food pyramid, which has now shifted to a food plate, they just kind of spread it out over a plate instead of the pyramid. It's the same here, just on a plate. These are the things that are happening. We've had to increase stadium seating sizes. We've had to increase the braking systems on the airplanes and on the public transportation so that you don't wreck. We've had to increase the seat size. Those of you that flew here will notice that the seats are, well, if you get a newer plane, the seats are bigger. When I was in the military, they actually reduced the entrance examination levels for physical activity so that they could allow people to get in the military. You'll notice these ads in the military, they can't get people in fast enough because they don't qualify physically. Now we have the Big John toilet seat. It's awesome, isn't it? And what affected me and my family is now we have a double wide casket. It costs twice as much. I know that because we had to bury my father at 58 in the double wide, but those are now true. They're here. They're here to stay, unless we change it. So 40 million members of the United States, 40 million Americans are on food stamps. And the challenge is that if you're on food stamps, you gain 5.8 pounds per year more than the person who's not on food stamps. And that's because our policies dictate carb toxicity. They literally do. That carbohydrate disease, I am actually carbohydrate allergic. You give me carbs and I swell up. That's what happens to all of us, right? So I just tell people, when I show up at my neighbor's house and they say, oh look, there's all this bread and stuff, I say, I'm sorry, I'm allergic to carbs. And you say allergic to nuts, and people freak out, they want to, they're going to dance around you and make sure you're happy. If I say I'm allergic to carbs, guess what? They give me a ribeye. It's great. All right, so as you've heard quite well, there are many diseases related, and Ken did a wonderful job talking about the pre-diabetes or the carbohydrate toxicity issues that arise with hyperinsulinemia, this overproduction of insulin. These are all the things that happen when you overproduce insulin. These are all the things that happen when you're obese. The two are correlated. They're the same problem. All of these disease processes are driven by an overproduction of insulin in response to starches or sugars. And we're going to jump into this. But the big challenge is that we first have to recognize, and I'm excited to see so many physicians and medical providers that are here that are recognizing, hey, we have a problem, and we've got to change this, and it's related to our diet. Now, these are 3 of the 6 horses that I have on my little ranch. That's my horse, Bailey. Unfortunately, my wife's horse and this horse here, which is Naya, are insulin resistant. They also overproduce insulin in response to starch and sugar. And did you know that grass has different levels of sugar? Alfalfa is 33% carbohydrate. Bermuda is down to 15%, but if it's in the summertime and it's hot and you cut it, the grass content goes up. Now, most of you here in the Midwest might know that. I didn't know that. But what happens is if I give my horses too much starch in their grass, they form laminitis and founder, and we have to put them down. that horses have the same, all mammals can have carbohydrate toxicity. And so to prevent our horses from having Cushing's disease, founder, and laminitis, we have to keep the carb content of the grass lower and exercise them, which is what I'm doing right here. Well, kind of. All right. This is my father. What drove this process was I came out of medical school 65 pounds heavier than I am today, following exactly what I was taught to do in medical school. And for the first 5 years of my practice, I was doing the same thing. My father weighed almost 400 pounds at age 58. He had a quintuple bypass at 42. 3 of those were stented a few years later. His kidneys failed him. He was on dialysis for the last 5 years of his life. He had what are called Charcot disease of the feet, where his heels literally collapsed because of the weakening of the bone related to all of the side effects of diabetes. And he died at 58. My concern was that at 32, his labs and my labs looked identical. I had a triglyceride in the 450 range and was exercising. I was actually running triathlons. I was exercising an hour a day and 2 hours on the weekends and eating a low-fat diet, and it didn't work. And it didn't work for 3/4 of my patients. And I thought, something's wrong. So I went back to try to understand, what is this obesity thing? And realized it's not the fat, it's the sugars. So this is my father when he came out to see me in medical school, and this is a couple of months before he passed away. What drives me, my why is, he never saw my kids. I want my grandchildren to know who I am. What is your why? Why are you doing this? Why are you here? That's why I'm here. And that's why I want my patients to be around a little longer. Hopefully that has some power to you. Now in my office, calories are a swear word. I'm going to explain why. Because they're actually little tiny creatures that live in your closet, so your clothes tighter. That's really what they are. But calories don't count, and we're going to talk about this and what this means. We've been sold a paradox. We've been sold a deal of goods that have basically told us that, hey, if you just restrict your calories, you're going to get better, and it's actually made us sicker and worse. And that's one of the challenges that arises. There's this obesity paradox there. It's there. And let me explain why. The 3 largest studies ever done in the United States looking at weight loss, calorie restriction. The first one is the Women's Health Initiative. This is about 49,000 women who were followed about 5 years. They're postmenopausal. They were nurses, and so they ate really healthy in the hospital, right? There was a low-fat, calorie-restricted group and a regular group. And the challenge is that they lost a whopping 0.8 pounds in 8 years. Very successful, right? But we quote this study all the time. Oh, look how well they did. It was wonderful. They lost weight. Yeah, they lost a pound over 8 years. Now, the next one, the multiple risk factor, the Mr. Fit study is what it's called. This was 12,000, actually almost 13,000 men. These men were followed for heart disease because they were at risk for heart disease. They were all placed on low-fat, calorie-restricted diets, and it absolutely failed. They did not lose weight, they did not reduce heart attacks, and they did not reduce their mortality, their death from heart disease. And that was over 7 years. But yeah, I still have pharmaceutical reps quote how wonderful Mr. Fit was and what the outcomes. What? It wasn't successful at all. And then there's the one that's quoted by all the cholesterol companies, the cholesterol drug companies, the Look Ahead study. This was an intensive lifestyle modification trial. It was supposed to last about 13 years. They stopped it at 9.6 because it failed. They did lose some weight. They lost 6 pounds, roughly, maybe close to 10 for some of them, but they had very intensive coaching. This was like these men, which were diabetic and had heart disease, were basically put on the Biggest Loser track, essentially, and someone yelling at them every day and checking their weight, and so they lost. But it did not reduce heart disease, and it did not reduce mortality. They still died at the same age. They just had someone yell at them all the time about their fat. 67,000 people, and we still didn't learn from this. Calorie restriction, fat restriction, and the failure of 60,000 to 7,000 people. 3 largest studies we've ever seen. Absolute failure. And they're often too weak to follow our own best judgment. Yet we still follow this and say, oh, calories, gotta watch those calories. And then I say, it's not the calories, it's the hormones. And we're going to talk about that. You've already heard about this, but people say, oh, you're wrong. It's that first law of thermodynamics. Well, the first law of thermodynamics basically says that you cannot, energy, you can change the form, but you can't destroy it or make it out of anything, out of thin air. The challenge is that there's actually more than just one law of thermodynamics. There are 4. And the calorie fits into the first law, but it doesn't fit into the second law. The second law is the law of entropy. If I take an ice cube and I put an ice cube here in the room, That ice cube will melt to room temperature. And if I cool the room down, it'll go back to ice. And that's because that energy is transmitted. And when you have and let me explain it this way a little easier. When you have a system that's cold here and hot here, eventually they'll both become the same. Unless you have hormones. And your hormones turn off the gate here. They close the box. And if there's a hormone that shuts the door here, this will stay cold, this will stay hot. We have 40 different hormones in our body that do that every day. A calorie is not a calorie in weight loss. Because you burn calories different than I do because your hormones are responding to food different than mine are. That's the second law of thermodynamics that people somehow forget. You can't expect balance. So the weight that we gain or lose is not driven by calories, it's driven by hormones. 85% of the people that walk through my door have some degree of hyperinsulinemia, carb toxicity. The other 5 to 10% have some sedentary issues. And 5 to 10% have thyroid problems, other sex hormone problems, genetic hormone issues, things of that nature that arise. 85% of what I see every day, though, is overproduction of insulin in response to starches, and we're going to talk a little bit about that. Now, I don't want to demonize insulin because insulin is important. Your insulin at the baseline is essential. However, insulin does all these really cool things when you overproduce it. If I give you a piece of bread, theoretically you should produce a slice worth of insulin. But if you give me a piece of bread, and I'm insulin resistant, I have my dad's genetics, I produce 20 times the insulin response to that piece of bread. If I eat one piece of bread, my body thinks I ate 2 loaves, and it stores fat as if I did for the next 12 hours. And you're doing that too. Guess what? Welcome to the club. It causes weight gain. It decreases nitric oxide, which actually raises your blood pressure. It raises your sodium. It's not the salt that causes the problem. It's the insulin in response to the carbs that raise your sodium. Your blood pressure goes up because of that. Uric acid and calcium oxalate. Have you heard of kidney stones before? It's because of your bread and your fructose and your alcohol, which is processed identically to fructose. Small dense LDL cholesterol goes up, triglyceride goes up, free radicals go up. Your thyroid peroxidase antibodies go up. Have you heard of Hashimoto's thyroiditis? I've reversed multiple cases of it just by cutting out carbohydrates. Estrogen goes up in men and down in women. Testosterone goes up in women and down in men. It turns men into women and women into men. And you get increased inflammation. Insulin is a great thing, except when you overproduce it. These are all the diseases of civilization. This is what I see every day. This is actually what keeps me in business. All right, so Ken did a great job in explaining this overproduction of insulin and how insulin's a problem. I noticed in my practice as I was going on that this pattern started arising, not with the sugar, but with the insulin. So if you came into me and you're normal, your insulin when you fast should be less than 5. And 2 hours after you eat a meal, that insulin level should drop back down to 40. But if you're insulin toxic or carbohydrate toxic, producing too much insulin, hyperinsulinemia, your fasting insulin will be somewhere between 6 and 30, or your C-peptide will be high. I know you guys are actually part of the way in your diagnostic training for diabetes already, because Ken just proved it to me. Your postprandial, 2 hours after meal insulin is somewhere around 90. That's the first stage of insulin resistance, as we've called it, or hyperinsulinemia. This happens 20 years before you ever get to type 2 diabetes. Type 2 diabetes is the 4th stage, where your fasting insulin is above 30, and your postprandial insulins are over 150. I've seen postprandial insulins at 300. And I've seen this in 9-year-olds. Just diagnosed my 2nd case of type 2 diabetes in a 9-year-old. Saddest thing I've ever heard. And then like my father, after a while, after you've been doing this for 40 or 50 years, your pancreas burns out. And then you see that insulin level drop, and that C-peptide drop, and that postprandial insulin looks almost normal, but their blood sugar's in the 200, 300, 400 range. That's the sliding scale of hyperinsulinemia. This happens 20 years before you ever get to the type 2 diabetic diagnosis. Hopefully that makes some sense. Now, why do I talk about that? What's the important thing about this? Well, weight loss is driven by the hormones you produce in response to your blood sugar. Your liver has a primary job, and it's not to filter things, and it's actually not to make ketones. Your liver's primary job is to produce enough sugar for your brain to be happy. And your brain is happy when your body's blood sugar is somewhere between 70 and 100. I think 95, but 70 and 100 is what we're saying right now. When your blood sugar drops below 80, your insulin starts to fall. That's why carbohydrate restriction works. That's why when you stop eating the sugar, it works. There's no drug that does this. The next step is glucagon kicks out with epinephrine when your blood sugar drops below 70. And then when your blood sugar drops below 67, you kick out norepinephrine growth hormone. That's why our athletes are not insulin resistant or hyperinsulinemia, because they're constantly, in their heavy-duty exercise, pushing their blood sugar down for short periods of time and raising their growth hormone. That actually causes muscle development, muscle building. This is why you see some of the guys that are here that are so successful with muscle building, is because their growth hormone kicks in, their norepinephrine drops, and they're maintaining their testosterone. When your blood sugar drops below 65, your cortisol goes up. That stimulates an increased production from the liver of glucose. It stimulates the liver to kick glucose or sugar out, so your brain is happy. The body's whole job is to keep that fatty organ in your head with sugar between 70 and 100 because it has to make neurohormones. All right, and then when your blood sugar drops below 55, you start to see the autonomic nervous system kick in. We're going to talk a little bit about this, but this makes you dizzy, lightheaded, and sort of shaky, and you're hypoglycemic at this point. And lastly, when your blood sugar drops below 50, rigor mortis kicks in. Kind of slows you down socially. All right, I don't want to overwhelm you with hormones, but I want you to understand that lowering that glucose allows you to lower the hormones. These are all hormones that drive your ability to lose or gain weight. It really is, it's science. It's not magic, it's just science. So, if I give you sugar, and this was done so well yesterday with Dr. Boz, she showed us that sugars turn into pyruvate, which turn into acetyl-CoA. They kick out through the Krebs cycle and produce this one little molecule called ATP, adenosine triphosphate. It's what lets me go and flex my muscle. It's what lets my heart beat. Adenosine triphosphate is essential for the muscle to contract. Without ATP, you also get rigor mortis, and it slows you down socially. You need it. You've got to have this hormone. Now, let's say I take away your carbohydrates. Then your body, it can use protein a little bit, but protein needs to be used for your hair and your muscles and your body. Your body knows that. It wants to look good in front of the mirror. So your body instead will use triglycerides and will convert them into ketones. The ketone, as Dr. Boz showed you so well yesterday, it forms ATP as well. It's just really efficient at doing it. And the brain can use it as well. The brain doesn't actually need glucose for fuel. The brain needs glucose to make neurohormones like serotonin and dopamine and norepinephrine. All right, so the liver's job is to produce glucose, sugar. That's its primary job. And the insulin counterbalances it. And what I was taught in medical school was this is the whole end-all be-all of diabetes. And that you were overproducing this insulin. But that's not the case. Your hyperinsulinemia is not due to a problem in the pancreas or a problem in the liver. It's due to a problem in the fat cells. There are 8 hormones that are produced by the fat cells, that as the fat cells get bigger, they get sicker. And as those fat cells get sicker, they overproduce hormones. What happens is adiponectin and leptins are supposed to suppress the production of glucose. Resistin is supposed to increase the production of glucose. And 2-necrosis factor alpha and interleukin-6 actually inhibit the ability of insulin to be effective when it's produced by the pancreas. You'll also notice that 2-necrosis factor alpha and interleukin-6 are also found in every cancer that we're aware of. Are the fat cells causing us to have cancer? Sick fat cells are overproducing hormone that change the way the signal of insulin is being received by the liver, so the insulin has to produce more, or the pancreas has to produce more insulin. This is sick fat cells overproducing hormone to try to help the liver do its job. And as those fat cells get bigger and bigger and bigger, the hormones are goofy. This is the reason that when someone does a high protein diet and they cut the fat out when they're insulin resistant, it doesn't work because protein also stimulates an insulin response. So in my patients who are morbidly obese or are very hyperinsulinemic, I have to moderate their protein and give them high fat because the high fat turns into a ketone, and amazingly, the ketones suppress all 5 of those hormones. If your ketone level goes up, it suppresses the fat cells' abnormal signaling and allows the fat cells to begin to shrink and to begin to heal. That's why I'm such a proponent of ketogenic diets, of carnivore diets, and in severe cases, I use exogenous ketones to jumpstart this process. That's why I like them, that's why I use them, and this is how I use them in my clinic. That's a lot of science, and I hope that was clear to you. Clear as mud? All right, okay, good, okay. All right, so, truth number 3. If you're just starting this process, do not fret. it's going to take at least 2 or 3 months for you to wrap your head around it, and 2 or 3 months for you to keto adapt. Don't forget to salt it. Your keto flu, you gotta have salt. Remember, when you're doing a high-fat diet, you gotta restrict salt. Or a high-carb diet, restrict salt. When you're doing a high-fat diet, you have to replace the salt. Important, and it takes you a while for your body to upregulate the ability to absorb fat and ketones if you've been burning sugar for most of your life. Truth number 4, entering ketosis is not always simple. This is what I do with my patients. Cut the carbohydrate to less than 20 grams per day. That allows those fat cells to shrink and heal. Some patients are coming in, their weight's fine, so we just cut their carbs to less than 10 to 20 grams per meal. Their cholesterol improves, their blood pressure improves, their numbers dramatically improve. But if you are pre-diabetic, if you are hyperinsulinemic, I have yet to see a patient truly reverse this process unless they cut the carbohydrate intake, total carbs, not net, to less than 20 grams per meal. Net carbs is just a marketing ploy. Dead serious. All right, you want to be monitored by a physician, because when you do this, if you're on diabetic medicines and blood pressure medicines, you're going to see your blood pressure suddenly become normal. You're going to see your blood sugars suddenly become normal. I had one lady call me up. She was a great patient, did really well, but she called me up and chewed me out. She said, "Dr. Nally, you almost killed my husband." I said, "Who's your husband?" "Well, he's not your patient." "But I put him on your diet. And he was on 4 blood pressure medicines and he passed out." "Yeah, okay. Within 3 weeks of being on the dietary approach, it worked. If you give me 4 blood pressure medicines, I'm going to pass out right now." But nobody was monitoring it. So you need to be monitored by your doctor. If you're on medicines, I want your doctor to watch you so you can have those medicines adjusted if your blood pressure or blood sugar or cholesterol begin to fall, because they will. All right. A high-fat diet is any diet higher than 30% fat. Now, many times if you eat a ketogenic lifestyle, that's up to 70% fat. But a high-fat diet is defined as anything over 30%. And that fat level we use as a modulator to control your hunger. You may only need 30% fat in your diet, but you might need 70. That's what a high-fat diet is. A high-protein diet is anything greater than 30% protein by a calorie, if you count it. All right? Bacon is a perfect food because it's 30% protein and 70% fat. It's a ketogenic food. We moderate our hunger by the use of fats. All right. Anything that kills your ketosis are these following things. I want you to be aware of it. Any complex carbohydrate. Yes, your sweet potato will kick you out of ketosis. And so will your oatmeal. Stop with the oatmeal. And Cheerios are not ketogenic. Simple carbohydrates, sweeteners, excessive protein. There are 10 proteins that actually produce an insulin response. Not huge, but enough that if you produce 20 times the insulin like I do, excessive protein will kick you out. And I see it all the time, and it'll halt weight loss. As your fat cells get better and you become less and less insulin resistant, we can actually use more and more protein. And then you can look like Danny Vega. Leaf-based teas. There's a tannin in the tea that actually spikes insulin by itself. There are 5 wonderful studies done in the 1950s when we were trying to use black tea, green tea, and oolong tea to treat diabetes before insulin became the norm. Any of these sweeteners kick you out as well, so be aware of that. All right, weight loss requires, now, a number of my patients start the process. 9 months into the process, they call me up, they're upset, they're angry because they didn't lose any weight. Well, that's a thyroid problem, so we need to check your thyroid. It might also be a female hormone or a male hormone problem, so those need to be checked. So if you have done this process and you've not seen success, get your other hormones checked out. You've got to have a functional thyroid. You've got to have functional sex hormones. This is a patient of mine that had bariatric surgery. This is 5 years post-bariatric surgery. She regained 130 pounds. Most of them do. 5 to 10 years later, they're in my office going, "I don't know what to do." And the bariatric surgeon goes, "I don't know what to tell you. I already did my job." She gained 130 pounds, so we put her on a ketogenic lifestyle, and literally in a year, she lost 75 pounds and looks fantastic. We had to modulate her thyroid, and we modulated her estrogen because they were slightly off. But it wasn't the surgery that fixed all the hormones. That only fixes one hormone. It fixes ghrelin. But that's one of 40 different hormones that may be off, causing that weight to rebound. And this is what happened to her. She was diabetic, pre-diabetic, became diabetic again, and now she's normal. Successful ketosis doesn't always affect the scale, though, because you may gain muscle and lose fat at the same time. It just makes your pants fall off. All right. In the last little bit here, I want to, and I don't want to overwhelm you with science. I know you're not physiologists, but maybe some of you are. But what I want you to understand is a couple things. There are basically 5 back doors to the fat cell. Fat enters the fat. This is a fat cell, an adipocyte. Fat enters by having a higher insulin. When insulin goes up, fat enters. There's only one way for fat to get in the fat cell. Insulin turns on lipoprotein lipase and fat enters. If insulin is not turned on, fat will not enter the fat cell. If you've ever seen a type 1 diabetic who doesn't take his or her insulin, they're skinny as a rail. You've got to have insulin to get the fat in the fat cell. If you're overweight, your insulin's too high, period. Now, the back doors may also be broken. We've got to turn insulin down because one of the back doors is fat can also exit the fat cell as insulin drops. Second, your thyroid hormone has to be functional. If you're not converting your T4 to your T3, it will not stimulate adenylate cyclase and will not open up door number 2. Number 3, catecholamines, epinephrine, norepinephrine. These are hormones that occur when you exercise, if you're physically active. Now, not all of my patients can be physically active, so this is a struggle for some people, but a daily walk, when we bump those up, you'll see success. Number 4, testosterone. Amazingly, insulin suppresses testosterone production by over 50% in men. Kind of cool, huh? Turns men into women. That's why guys have man boobs. That's the reason. Their insulin drops, their testosterone lowers, their insulin goes up, testosterone lowers, estrogen goes up, and it slows down their weight loss. Lastly, ketones, which comes from a ketogenic diet, and short-chain fatty acids actually open up door number 5. I can use drugs like phentermine to do that too, but guess where you can find short-chain fatty acids? Butyrate. Guess what butyrate is? Butter. So your fat, butyrate, and ketones you make from it actually help assist in your weight loss. Hopefully that's a little more clear. Some things just to think about with thyroid, and I'm not going to dive into these because I've only got about 4 or 5 minutes. Number 1, if you're doing a ketogenic diet and you've been given thyroid medication and you get heart palpitations, you might be getting, it's probably one of your salts that are deficient. Sodium, potassium, magnesium, and zinc. These are electrolytes, they're also salts. Sodium's a salt, potassium's a salt, magnesium's a salt, zinc's a salt. If you get cramps during the daytime, it's a sodium or potassium problem. Cramps at night, it's a magnesium or a zinc issue. You want to supplement your salts. Now, I love Redmond salt, they're out there, they're one of my favorites. There's any salt that has all 4 of those in it is wonderful. So you want to use something that does that. If the salt is pink, it has that in it. It has all 4, pardon me. A healthy gut's essential because you've got to be able to absorb the hormones appropriately and convert them, and I won't go into that very heavily. If you've had a heart attack, that stress response will give you an abnormal thyroid function, so don't check your thyroid for a couple months after having heart issues, and I won't go into this real heavily because I don't have time. But if you're having increased fatigue, after your thyroid is being balanced, it may very well be that you've got an overdosed T4 or not enough T3. I won't go into that heavily. The other concern is sometimes what we found in kids, and the reason that you still have people decrying ketogenic diets is they say, oh, it'll kill you, it causes selenium deficiency. It actually doesn't. The epileptic kids who were given the original ketogenic shakes have no selenium in them. And when you're selenium deficient, it actually will cause heart problems. When you discover that you need selenium, you're fine. Where do you find selenium? Seafood, oysters, clams, those are all eggs. You find selenium in all those components. Treat the mitochondrial dysfunction, and you do that by carnitine. Guess where the best place to find carnitine is? Ribeyes. All right. You can refuel the mitochondria. A lot of people who have mitochondrial disease or fibromyalgia or chronic headaches that don't improve with a ketogenic lifestyle usually are deficient in one of these components, specifically carnitine, especially in our vegetarians and vegans. I see a ton of this because they just don't have that fuel available to their body's biosystem to function. I'll let you take a picture of that if you haven't, but if those are side effects that you're not seeing improve, this may be the issue. Your mitochondria may not be efficiently functioning. Choose number 5, and I'm going to dive through this real fast. Exercise. If you exercise without the correct diet, which is what I was doing, it's like trying to empty your pool with a teaspoon. So you've got to fix the diet before the exercise is going to be effective. Once that happens, you're great. We already talked about that, and I'm not going to dive into it. Truth number 7. You can suppress your hunger by the use of medium and long-chain fatty acids because they get converted into ketones. If you're just taking MCT oil, you're missing the benefit of the true long-chain fatty acid and the cholesterol. Your real food is what I'm a big emphasizer of because it helps you produce cholesterol. You have to have cholesterol to make all of these hormones, which has already been said yesterday. And the amazing thing is that your ability to absorb animal-based cholesterol is 50 times greater than that of plant sterols. You have to eat literally a boatload of kale to get those phytosterols. You might like kale, I don't know. All right, don't let your decisions be based on the advice of those who don't have to deal with the results. All right, Cholesterol turns into sex hormones. If your sex hormones are off, you may not be eating enough egg yolks. Guys, if your wife is eating the egg white omelet, make her eat the yolks. All right, you've already seen this again. I won't go through that. Lastly, stabilize your ketogenic diet through good foods. Now, hard cheeses for many people work really well, but Velveeta is not cheese. It's like cheese food. You feed it to cheese or something. I come from Arizona. People live off of avocados. An avocado is a fruit, and it has 20 grams of carbohydrate in the big avocados. Some of you have these little bitty avocados. We have big ones in Arizona. Avocados are kicked out of ketosis, and there's fructose. The fruit in that process that ends up with alcohol. So be careful of that. Be careful of the portions of nuts because they do have carbohydrates in them, and if you're carbohydrate toxic like I am, they're a problem. All right, stress. I'm going to finish this up in the last bit here with stress. Are you married to stress? The issue is this. Your stress system kicks on the autonomic nervous system, the sympathetic system. It's the fight or flight. If a bear is chasing you, your body kicks all its blood to the organs so that you can run and fight the bear. Now, the challenge is that kicks out a whole host of hormones. Adrenaline, cortisol, all those kind of things. That is equivalent to a donut. So if you're having chronic stress, it's like you've had a donut. It really is. Let me explain why, and I want you to see this. This is a normal blood sugar. I love continuous glucose monitors because I have a patient who is doing quite well, maintaining her blood sugar very, very well, and then she has emotional stress. Look what emotional stress does to you. Spike in sugar, spike in insulin, spike in sugar, spike in insulin, spike in sugar, spike in insulin, spike in sugar, drops normally, spike in sugar, spike in insulin, spike in sugar. She'll never lose weight. That's the autonomic nervous system. That's what it does to you. It kicks on cortisol. Your insulin rises. The blood sugar drops. This happened. This was only 24 hours. She shut off her weight loss in that period of time. And that's just an emotional, she was eating correctly, she was exercising, but she was having emotional stress. And it's a pretty significant issue. I don't have time to dive through all this, but this is what happens. It kicks out that cortisol, stimulates glucose, and then your body starts chasing the roller coaster. And that's what stress does to you. This is the stress response. These are the hormones that are kicking out during stress, so you're aware of it. And I'm going to dive through this. Is the last thing. How do you fix that problem? Number one, if you're getting up at different times during the day from rest, fixing that is probably the most effective way to fix it. Get up at the same time every morning. Doesn't matter when you go to bed. Get up at the same time. That stabilizes your cortisol really effectively. Second, if you have this issue with emotional stress, you need protein and fat at your breakfast to stabilize your blood sugar. Now, should I fast or do I should fast? No, you have a problem with your autonomic nervous system. You need protein and fat when you wake up to stabilize that. And that's effective. So getting up at the right time, stabilizing your protein and fat intake. Exercise plays a huge role in blowing off that excess adrenaline and cortisol. And then lastly, you want to automate the activities of daily work. Things that stress you out are not automated. Your brain can't take care of them easily. If you remember backing your car out, when you first backed your car out of the garage, it probably took you 15 minutes. You probably did it this morning and didn't even think about it. Those are tasks that your brain has to automate. If you're doing multiple things each day that are not automated by your brain, getting up at the same time, going to bed at the same time, doing things automatically, your brain has to put extra effort into it and it's stressful. Think about that in your life. Keep a journal. I have patients keep a dietary journal, and this literally is cognitive behavioral therapy. I don't have to send them to psychiatrists because they keep a journal. That journal helps them identify these problems in their own life. And this is how I found this problem with the stress. I looked back and said, what did you eat? She was fine. Well, what did you do that day? Oh, it was a really stressful day. Well, show me your continuous glucose monitor. Holy crap! No wonder you're not losing weight. I'm a delicate feminine flower. Give me back my saturated fat coconut oil. You need this. You've got to have this, especially if you're female under stress. All right, this is my elimination diet. Remove anger, regret, resentment, guilt, blame, worry, and garbage. Add bacon daily, and as you watch as light fills your life, health fills your navel, and happiness fills your soul. That's my elimination diet. All right, supplement appropriately. I'm just going to touch base really quickly that number one, you've got to make sure that you, some of you may have, well, let me back up. 60% of my hyperinsulinemic patients don't methylate folic acid correctly. If you don't methylate folic acid correctly, you can't absorb B6 and 12. And it'll cause the neuropathy in your feet, it'll cause increased anxiety and panic, and it will cause fatigue and weight loss and inability to lose weight in many of my patients. Methylated folic acid can only be tested through a genetic test. This is not methylated B12, this is methylated folic acid. Now, if you overdo too much methylated folic acid, it'll give you anxiety. So this is something you want to check with your doctor about, but I have a percentage of my patients If you have neuropathy burning in your feet, you probably have this problem, and you need to look at adjusting the methylated folic acid in your diet. It helps with these things here. That you want to get, this is the active form of it, and I'm going to jump in. Lastly, sleep. That time of apoptosis, testosterone rejuvenation, and muscle recovery. Sleep is essential because it's like being dead without the commitment. If you're not sleeping, you're not resetting that cortisol balance, you're not decreasing the stress. You've got to sleep. Plan in your day some sleep. You've got to make sure that sleep is appropriate and get up at the same time every morning. Can't emphasize that enough. So how do you get started? Cut the carbs less than 20. Shoot for adequate protein. Use food substitution. If you have those foods that you just crave, every time the TV turns on in my home, I to this day still crave a large bowl of popcorn and a large Pepsi because that was love in my house. To this day, it still happens. So instead, I just pull out the pork rinds and some sparkling water. And it gives me the tingle that I used to get. It works. Find a substitution that works for you. Welcome to the tribe. It's a great group of people. You've already met them. And then look for some good books. Bacon is the duct tape of the culinary world, just to tell you that for sure. The end. Thank you guys.
Drop muscles, everybody. Drop muscles. One time. Yes.